everyone, I'm Dr. Pranjal Jain and today we are back with another episode of concising and compiling stuff for you to remember better for your NEETPG exams. Today we have fractures. We will divide them into upper limb and lower limb fractures and we will try to merge them into one page each. So at the end of this video you will only have to revise 2 pages, one for upper limb fractures and one for lower limb fractures. Let's start. Here, the bones majorly which we need to study are the clavicle, then humerus, radius and ulna or the forearm bones, and the carpals and metacarpals fracture, right? For this, we have a scary image of all the fractures of upper limbs which look something like this. Don't worry, we'll break it down into 3 parts of 4 fractures each. That is fractures of arm, fractures of forearm and fractures of the palm region, and we have 4 fractures in each of them. Let's see them one by one. First, the arm region. Here we have the fracture clavicle, we have proximal humerus fracture, then we have fracture of the spiral groove known as the Holstein-Lewis fracture, and then 2 fractures near the elbow region, that is the supracondylar fracture of the humerus and the lateral condyle humerus fracture. Now here basically we need to know the details about clavicle and supracondylar lateral condylar fracture. First, clavicle. Clavicle is the most commonly fractured bone at birth as well as overall. Adults may at any age, if you just pick up most commonly fractured bones, it is clavicle. Where does the fracture happens? At medial 2/3, lateral 1/3. Then the other 2 important fractures are supracondylar and lateral condylar. We'll study them in a table format. Supracondylar. Since above the condyle it is broken, the 3-point relation here is maintained. Both the condyles as well as the olecranon are in the same relation. But in lateral condylar humerus fracture, the lateral condyle itself is gone. So the 3-point bone relation is disrupted. The classification used for SCFH is Gartland classification, while here it is L and Milch classification. SCFH undergoes malunion, whereas LCH undergoes non-union. Important, frequently tested. Other complications can be nerve injury and brachial artery injury here, but the most common complication of lateral condylar fracture is lateral bony spur formation. Last, the mechanism of fracture. Supracondylar fracture is a static fracture, therefore there is no hurry for a treatment. But LCH is a dynamic fracture. There are muscles attached at this condyle and it needs to be fixed ASAP. That is why we do Milch osteotomy as soon as possible here. But in SCFH we only provide traction and supportive treatment. Now moving on to the forearm region. Here we have 2 bones, the ulna and the radius, and we have 4 fractures. Ulna ka fracture, Monteggia. Radius ka fracture, Galeazzi. If either of the bones is fractured in a children or due to a fighting, they are called as stick fractures. We will study them. And last, if distal end of radius is fractured, we have the famous Colles fracture or the Smith fracture. Let's study them one by one. So Monteggia and Galeazzi. Monteggia is the fracture of superior part of ulna as seen in the image, and Galeazzi is the fracture of lower part of the radius. Okay, both of these are fractures of necessity and they need to be treated immediately. Then the stick fractures. What do we mean by stick fractures? It is basically nightstick, green stick and torus or buckle fracture. Nightstick fractures is that if someone hits you with a stick in night, you will protect yourself like this. Stick aise pada, so your ulna is fractured. So ulna shaft fracture is nightstick fracture. Green stick is basically a wet stick which doesn't break easily, it just bends. So a unicortical fracture of the forearm bones, mostly in the diaphysis, that is bending. Torus or buccal fracture is just to compare with the green stick fracture, that it is a bicortical fracture of the forearm bones, usually in the metaphysis. Okay? So nightstick is ulna completely broken. Green stick is ulna with a bend because only one of the cortex is broken. And torus or buccal is complete. Last, the Colles fracture, and probably the most important fracture. Colles is an extra-articular fracture at the distal end of radius. It has a dorsal displacement. Iska bhai Smith is also an extra-articular fracture at the distal end of radius, but it has a ventral displacement. Okay. Now, what are the complications of Colles? Most common is finger stiffness. Other than that, there is malunion here. Malunion would lead to a deformity called as dinner fork deformity. And you treat it using a Colles cast, which you apply in a handshake position. Okay? These are the fractures of forearm. Moving on to fractures of the palm region. Here we have mainly two fractures, first metacarpal and fifth metacarpal. First is Bennett or Rolando, depending on the number of parts of fracture, and fifth metacarpal is fractured when you are boxing. The fifth metacarpal is fractured and thus it is called as boxer's fracture. Two other injuries of the hand which are not fractures per se but ligament injuries which are commonly asked, we'll combine it here only. So gamekeeper's thumb, if the ulnar collateral ligament is injured, and if the dorsal or volar tendon of the DIP is fractured, it is mallet or jersey finger. Most commonly questions are asked from mallet and jersey only, so let's study these. For this, you need to remember a small story that earlier there used to be only two professions. You could either undergo a more studious branch, you could pursue DM or DNB, or a less stressful branch of a video jockey or radio jockey. Okay? So either DM, DNB or VJRJ. How to infer from this is, if your dorsal tendon is ruptured, dorsal or extensor, if that is ruptured, you will have a mallet finger or a baseball finger. What this basically means is, dorsal side पे extensor tendon है, if that is ruptured, you will have a permanently flexed finger and the treatment would be hyperextension. This is all inferable. We just need to know कि नाम क्या है. तो dorsal is mallet or baseball, but if volar tendon is ruptured, the flexor tendon is ruptured, this is called as jersey finger or rugby finger. ठीक है? So two pathways, DM, DNB, VJRJ. Khatam. And gamekeeper's thumb is ulnar collateral ligament avulsion. So this is what upper limb fractures are. You can actually combine them in one single sheet and it would look something like this. Scary at first sight, but if you understand the gist, it's very simple. Okay? Take a screenshot, review it again, sort it. Moving on to lower limbs. Lower limbs mein we have the femur, the tibia and fibula, and the foot. Most questions come from the foot or the femur head. So the scary picture of lower limb fractures looks something like this. Let's break it down. On the head of femur, we have two fractures, the neck of femur and intertrochanteric fracture. They are commonly questioned, so let's study them in a table format. Neck of femur is an intra-articular fracture, whereas intertrochanteric fracture is an extra-articular fracture. Meaning, if it is inside the joint capsule, everything would be less here. Less pain, less trauma as a cause, less shortening of the limb, less external rotation, etc. But if it is outside the joint capsule, if it is extra-articular, everything has to be more. More force needed to break it, more shortening, because now the femur can go anywhere, right? So, intra-articular and extra-articular. When a patient of neck of femur comes, we usually feel the tenderness at scarpa triangle, whereas in intertrochanteric fractures, we have the tenderness at the greater trochanter. Complication of neck of femur fracture is non-union. Intertrochanteric fracture undergoes malunion. Treatment is the place जहाँ से सबसे ज़्यादा question आते हैं for these fractures. And this is not something you can mug up. It depends on clinical case to clinical case. We'll just study in a gist. For intertrochanteric fracture, no major surgery is needed. You just put a proximal femur nail or a dynamic hip screw. But in neck of femur fracture, the treatment depends on the age of the patient. If he's an old age patient, that is more than 65 years, you do hip replacement, either hemi or total hip replacement. But if the age is less than 65 years, you undergo closed reduction or osteotomies. Okay. The other fractures of lower limb are Hoffa's fracture, which is a bicondylar fracture, bumper or Seagond fracture. Seagond is nothing, it's just bumper plus anterior collateral ligament rupture. Toddler fracture is a fracture in small children in the tibia. Runner's fractures is something which occurs in unaccustomed runners. It's a fibular fracture. And then we have the pot or cotton fracture. Pot is a bimalleolar fracture. Cotton is a trimalleolar fracture. And last we have another bone called patella here, and we need to know about the treatment of patellar fracture. So for patellar fracture we have a special investigation, skyline view. Okay, and treatment depends on the number of parts of fracture. If it is an undisplaced fracture, there is just a fracture line but the patella is intact, we just put a cylinder cast and let it heal. If it is a displaced fracture, we do tension band wiring and we try to connect these two parts. But if it is a comminuted fracture, so many parts, there is no point in joining them, then we simply remove the patella, called as patellectomy. Then fractures of the foot. Here we don't need to remember details about any of the fractures. We just need to know which bone is fractured and what is the name, because these are all specifically named fractures. So starting off from distal to proximal. March fractures happens in young army recruits which keep on marching fast. So उनके second या third metacarpal में stress fracture हो जाता है, called as March fracture. Jones and pseudojones happens in the fifth metacarpal. Jones is an actual fracture, whereas pseudojones is actually a small part which is pulled due to muscle pull of peroneus brevis. Okay. Then if we have a fracture at the tarsal metatarsal junction, it is called Lisfranc. If we have a fracture intratarsally, it is called Chopart fracture. Chopart चौराहा, तो बीच चौराहे में हुआ Chopart fracture. Last, the null fractures. I have always confused these and I still don't have any way of remembering this. So if you do, please go and comment below. It will be really, really helpful. How I remembered this was a very stupid mnemonic. Null CTC. It doesn't even mean anything. Null CTC is basically how I remembered nutcracker aviator lovers, and these are fractures of your cuboid, talus and calcaneum. Okay, so with this your lower limb also comes to an end, and Again, compiling this on one page would look something like this. CTC. So with that, we come to the end of this video, the fractures of upper limb and lower limb as promised on one page each. So if this helped you, please press the like and subscribe button. Hoping to see you soon in more such videos. Thank you.